Good evening, everyone. Myself, Dr. Pramod, working as a consultant nephrologist and renal transplant physician in SS Hospital, Davangere. So, myself, I've done DM from St. John's Hospital, Bangalore. I finished in 2019. After that, I was working in Father Muller Hospital for 1 year. After that, I joined SS Hospital. So now I'm working as an associate professor here in Department of Nephrology. So today I'll be talking in brief about causes of pedal edema and CKD and what are the symptoms seen in patients with renal dysfunction. So shall we start now? First, let us see what do you mean by chronic kidney disease? It means that it's a continuing and permanent degeneration of kidneys. The kidneys are, as we know, kidneys are a vital organ in human body. They serve a variety of purposes, including maintaining the body's mineral and electrolyte balance, helps in regulating blood pressure, helps in synthesis of red blood cells, and also helps in maintaining or regulating acid-base status in the body. So once the kidney is damaged, we categorize the CKD into different stages. We divide the stages into 5 categories. In stage 1 CKD, the kidney is normal with more than 90% of the kidney functioning. And in CKD stage 2, the kidney function mildly decreases to 60 to 89%. In stage 3, it decreases to 30 to 59%. In stage 4, it decreases to 15 to 29%. In CKD stage 5, it is less than 15%. Usually, in most of the patients, when they reach CKD stage 5, we usually counsel them regarding the requirement of hemodialysis or renal transplantation at this stage. So, what are the symptoms or what are the signs which we see when patients are affected with the chronic kidney disease? The common symptoms which we see are they come with complaints of decreased appetite, swelling of the legs, and or swelling of the face. They complaints of nausea, vomiting, a complaints of itching, which we call with the term as pruritus, and also they have a lot of sleep disturbances, and also their appetite is also reduced, and because of decreased levels of calcium or there will be alterations in the phosphate balance or decrease in synthesis of vitamin D, patients also are prone to for muscle cramps. So now, since we came to know that patients can have different types of symptoms, so among them, let us discuss in brief about the pedal edema. So, what do you mean by pedal edema? So, pedal edema is the swelling of the feet and ankles caused by abnormal buildup of fluid in the ankles, feet, and lower legs. Edema of foot can be caused by different mechanisms. Among them, the 2 are important. So, what are the 2 reasons which are commonly associated with pedal edema? One is heavy loss of protein in the urine, or secondary to decreased kidney function. So this type of edema significantly can seen in 2 types of renal conditions. One is nephrotic syndrome and nephrotic syndrome. So what do you mean by nephrotic syndrome? Nephrotic syndrome is a loss of protein in the urine, which is more than 3.5 grams per dl per 1.73 meters square body surface area. So once this protein is lost, this gets decreased in the blood, which results in reduction of fluid in the blood vessels. The kidneys then detect a decrease in blood volume and attempt to retain salt. As a result, fluid gets collected in the tissues, predominantly in the dependent portions, resulting in edema. So pedal edema can also occur when someone stands or sits in same posture for an extended period. The symptoms of pedal edema include swelling or puffiness of tissues just beneath the skin, skin that is stretched or shiny, skin that retains a dimple or pits after being pressed for several seconds. So, what are the different ways in reducing pedal edema? So, let us discuss in brief one by one what are the different strategies or different ways how we can address this pedal edema. So, one is reduce salt intake. Edema can be exacerbated by sodium, which is present in the table salt and processed food. So, reduced salt consumption can help in minimizing edema, especially if patients are on diuretic. So usually normally the recommended salt intake which we take is around 5 to 6 grams per day. So in patients with edema or in patients with hypertension or in patients with renal dysfunction, so we usually ask them to take salt of less than 2.5 grams per day. So use of diuretics. So diuretics are the drugs that induce the kidneys to eliminate more water and salt, hence reducing edema. Because eliminating too much of fluid too rapidly can drop blood pressure, it causes lightheadedness or fainting, which we call by the term postural hypotension, and which in turn results in worsening of renal dysfunction. Thus, diuretics must be administered with caution. After using a diuretic, you may need to empty your bladder more regularly. However, when diuretics are used at prescribed dose, other adverse effects are infrequent. So what are these are adverse effects, other adverse effects? Usually, as I told, we have different stages of renal dysfunction. Usually in stage 5 CKD, the required diuretic dose will be more. So in case if they are not able to pass a good amount of urine, these drugs can get accumulated and it leads to temporary deafness, which again it's a reversible after we stop these drugs. Usually this deafness part will get reversed. So one has to be careful and be watchful when we administer these diuretics in advanced CKD patients. So compression stockings. Compression stockings can be used to both prevent and treat leg edema. Although good measuring and fitting of the stockings can limit the risk of discomfort, certain stockings can cause skin irritation or pain. Effective compression stockings exert the more pressure at the ankles and progressively decrease pressure up to the leg. So my experience is like it's always preferable to use crepe bandage compared to compression stockings, because these compression stockings I've seen in few people, they develop cellulitic changes, cellulitis and all. So because the compression effect is more with compression stockings when compared to crepe bandage, and with crepe bandage one can uh, decrease or increase the level of compression. It has adjustable hooks through which we can increase or decrease the compression pressure. And body positioning. Elevating the legs above the heart level for 30 minutes, 3 or 4 times a day can also help with leg, ankle, and foot edema to decrease. Additionally, elevating one's legs multiple times a day may not be feasible for individuals who are working. Lastly, it is not always possible to prevent CKD. Controlling diseases like high blood pressure, diabetes, on the other hand, can benefit. If you are high risk for CKD, you should get regular testing. Early detection of CKD can aid to slow its progression. Limiting salt intake, choosing foods with low potassium, having a good physical activity can help reducing pedal edema caused by chronic kidney disease. So along with this, one more tips which I want to give is excessive use of over-the-counter medications or use of some alternative medications without the advice or proper guidance of a doctor need to be avoided, because this also on long run it leads to renal dysfunction. So the take home message will be so one has to monitor regularly for blood pressure, diabetes. If present, one has to get it controlled as best as possible. And also lifestyle modification. If your BMI is more like more than 28, more than 20, more than 30, so one has to think what they can do to reduce the BMI, and also good lifestyle habits. Like the recommended is at least 30 minutes in 5 days of a week. One has to do brisk walking or jogging or whatever exercises they are comfortable with. And also in case if they have hypertension or renal dysfunction, so limit the salt intake to as much as possible. Normally recommended limitation will be like less than 2.5 grams per day is advisable. So, and good healthy diet, like avoid consuming oily foods, avoid consuming junk foods, avoid consuming storage or processed foods. Try to eat good amount of fruits, vegetables in your diet, and exercise. So these things need to be kept in your mind for a healthy life, and for healthy kidneys. So saying so, I would like to conclude this educational video. Thank you all.